Hi, everyone. I'm Matt Lau from NYRC, and I'm here on Truth and Reconciliation Day speaking with one of our assessors, Dr. Soma Ganesan, who's an expert in cross-cultural psychiatry and someone who has a vast experience working with First Nations and Indigenous populations. Dr. Ganesan, could you please introduce yourself and tell us a little bit about what you do and why speaking on Truth and Reconciliation Day is important to you?
Hi, I'm like Matt introduced, I'm a psychiatrist. I have been working in BC since 1988 and still doing that. I was a former department head of psychiatry at Vancouver General Hospital, UBC Hospital, Vancouver Community Mental Health Services, and also the medical directors of BC Center for Addiction and Mental Health before it moved back to the Riverview ground. One of the things that I've been involved with during my practice was developing the cross-cultural psychiatry program at UBC as a teaching program and also as a clinic at Vancouver General. Did a lot of work with the First Nation and the Aboriginal community. Actually, I participated with Fraser Health back to 20 years ago on developing the first CD on sensitizing the healthcare providers about what mental health means with Aboriginal and First Nation community. And that actually was the First Nation section of the Aboriginal mental health section at Vancouver Coastal Health still refer to that. And I still have, I should have that display, there's a plaque to commemorate my work there. And I also had several opportunities to work directly with the clients. At that time, the Ministry of Health in BC has a program to help with residential survivor trauma. And we had about 20 counselors working in that program. And those counselors report to a psychologist, and that psychologist report to me under my direction. So I had opportunity to review all of the treatment progress for a long time, ongoing for at least 8 years. And I also did a lot of work with Ron Peters, a lot of work in this field at the time, but even before anyone talked about reconciliation. And at that time, the service was scattered here and there. And then we at the Strathcona Mental Health Team, we also have a lot of First Nation representation there. And the psychiatrist there is providing service, actually did a rotation and trained by me at Vancouver General. So that is some of my background.
Thank you so much, Dr. Ganesan. What common health issues do you see in communities that have experienced long-term trauma? And how can medical examinations help?
It is a very interesting thing that you ask, because you see the long-term the trauma here is that's why we call it historical. This is the trauma here. Either people exposed to that is because of natural made, because of man-made, because of policy related, or because of behavioral and environmental issue. For the First Nation population, Aboriginal population, this is the human disaster is not an issue, but the other thing relate to policy, relate to mistreatment, relate to the prolonged exposure to trauma without recognition and without being addressed, and it pass on from one generation to the other. So they see that has a profound impact on everybody's day-to-day life. And I've been raising that question all the time. That's why there was an attempt here at the Ministry of Health a long time ago, 20 years ago, asked me whether I can take care of the Aboriginal, mental health side. I said, no, cross-cultural issue is different. There's a lot of similarity issue, but that we can learn and share with each other. But, the residential trauma, the long-term exposure, the chronic traumatization, and also being, and a lack of recognition and policy and protection are continuously being day-to-day trauma for the population. Therefore, the assessment and the treatment, the assessment first, need to be sensitive. One need to know the history. What we learn in psychiatry is asking a lot of indirect questions, which is good, and sometimes direct questions. Some of those questions are difficult to answer. And sometimes not answering is a big answer, very meaningful. Therefore, when we want to do that, one need to look at behavior, one look at expression, and one also need to look at know about the history so that they can avoid asking insensitive questions. Like some question that we see in mental health all the time is we've been asked to elaborate, the client to elaborate, saying that, oh, tell me more about that. That is very traumatizing. People people traumatize for a long time and said, tell me more about that. What do you mean? You have to learn it by yourself. You have to do some homework so that you can go along, the line and move along so that the conversation would be more open, more friendly and more supportive. A lot of time the assessment go nowhere. During the time that I was head of this section at Greater Vancouver Mental Health, it took 3 years for the client to open up to the counselor. Therefore, within 2 hours assessment, 4 hours follow-up, one can come to some conclusion, is maybe a preliminary thinking, but then along the line, this is the same thing with PTSD. Only when the client comfortable, trusts you, and then they're willing to share. Otherwise, this is just a facade assessment. I don't know whether I answer your question.
No, you did, and you actually answered another part of a subsequent question I had, which was, from your perspective, how can medical examinations and screenings be adapted to better meet the needs of Indigenous and other marginalized communities that have experienced historical trauma? And I think you gave a lot of great answers to that in your former response. So I appreciate that, Dr. Ganesan.
One more thing, since you talk about that, the physical issue need to be observed, and one need to be sensitive to that. Not just focus on the emotional sign and symptom only, because some of those, trauma relate to the physical, kind of like mistreatment. And people sometimes don't want to talk about that. So one need to, and only when the report is better, people willing to open up. Therefore, don't expect within 2 hours, you get the whole history.
Can you give us an example of where a medical exam helped address a health problem linked to historical trauma?
There's no term for psychiatrists. There's no term in Aboriginal, kind of literature for psychiatrists, but this is a kind of a counselor working and they're doing with mental health. One need to be sensitive to the issue that people relied on the existing resources, which is a healer. And then in the tape that I produced together with other healthcare providers in Fraser at that time, addressed the important part of linking with existing resource currently available, linking with the healer, listen to the clients about what healing means to them instead of imposing our value on them. So listening, and comment only when necessary, and then should have an open mind to say that I need to learn more from you. Actually, there's no textbook that describes everything that all the trauma that people go through. You can collect it on the information to yin and yang, but it never ends. We can see that on the news all the time. Therefore, the best way to sensitize ourselves is to listen to the clients and to open the door for the clients feel comfortable in a comfortable environment. Okay, the environment should be, in a closed door. There should be have a window with the fresh air, a natural scene. The best would be even, doing an interview in, outdoor. That's what I try to do all the time, and very comfortable, not a formalized thing. And again, one of the things that I learned when I met with the First Nation, leaders, is I always prefer that they always prefer to have a round table so that we can sit around and talk about that. We link it that way. This is a lot of things like that with other culture too. The square office, a square table, the barrier between therapists and the clients, or the interviewer and the clients, through a huge traditional table with leather chairs does not work. And those are the message given right away to the client that, yes, we are sensitive and we are listening, and we try to create an environment that you are comfortable to talk.
That's a great point on just creating an environment that kind of breaks down some barriers and allows people to feel comfortable opening up, especially when they're dealing with such historical traumas. And you mentioned a couple times about the importance of building trust between the examinee and the person that's doing the assessment. What are some strategies outside of some of that you mentioned, creating a better environment, listening? What are some strategies or practices that you would recommend for companies in general to build trust and rapport with individuals from diverse cultural backgrounds, and particularly those affected by historical traumas?
Yeah, thank you. Now, as you know, this my understanding is most of the clients are at the middle age or the older age. The younger generation do suffer, but sometimes they suffer indirectly because of the issue passed on in the family. Okay, so with that, I think remove let's say, the assessment need to be done, the referral come from a nation that live far away from the city. And then you said, okay, the appointment is at, the office in downtown Vancouver or downtown Toronto. You have to travel down there and then go, to the office for assessment. That alone, to me, is a very challenging by itself. The best would be, to see the people where they are. And also creating now with the video link and everything, that probably is a very good tool to use. However, nothing replacing in person, but that could be done in the now. Matthew talked about assessment, but I think in my view, assessment also have a therapeutic value. With that, the assessment is therapy by itself. Therefore, you can see that several in your view and in your experience, there's several psychiatrists see the same patient, but they have different opinion, not because they are not competent, but because the client talk with them differently, depend on whether they trust them or not. So that is a thing about that, when one need to be sensitive. And the opening question is that, mostly we were trained in psychiatry and in mental health is, oh, tell me, what can I do for you? Well, you don't know. you open the door for something that you are not prepared for. So I think that one of the things that I would suggest is to introduce yourself and then make sure that you sit on the same level with the clients, and just say that you appreciate that they take time to access that. It is very challenging for them to participate, and we acknowledge that. And if there is any time that they feel discomfort on not, then please tell us. We can stop it, we can resume, and we can change the environment. And then also ask open-ended question. The question is, what can I do for you? And tell me more about that. Sometimes it's quite challenging. So you have to find a language that encourage people to feel comfortable talking without being challenged. And also, now you do a lot of work in medical legal issue. Now, medical legal sometimes sound very threatening to people, okay? Especially the level of understanding. So one need to explain about why there's a request for that assessment. But that request doesn't mean we have to stay with that, but we can modify the way that address the need of the clients, because you are there for client needs, you are not there for your need.
That's great, Dr. Ganesan. What I'm hearing is, build trust through transparency, serving people in their communities, balancing that, inherent power dynamic between a practitioner and an examinee, all of those things to build comfort and trust, and really letting them understand that they have rights in this process, and it's their assessment as well.
Yeah.
And really making them feel comfortable that they can open up in a safe and inclusive environment. So really appreciate that. My last question is really looking to the future, and what changes or improvements would you like to see in the mental health field to better support truth and reconciliation efforts and address the psychological needs arising from historical injustices?
I think that, I've been actually talking about that all the time. I was involved with Provincial Health Services Authority here when I was medical head of Riverview Hospital, and I participated in the first preparation on the training program for clients, for healthcare providers. Now, I know that now, trauma-informed consent and trauma-informed practice is now reflecting throughout every school at UBC. I'm sure other universities do the same. And that should not just with medical training, but all other training, human-related training, social work, OT, kinesiology, even surgeon need to receive that because sometimes some of the language used around the operating table cause a lot of trauma to people. And that I know that people are more sensitive now. We have been trained, but from training to implementing in the clinical practice is different. I know that the new generation of healthcare providers receive a lot of that. Now the College of Physician and Surgeon BC also will remind clinicians that they need the training. I'm sure the same other regulatory colleges remind the same. But there should be more and more opportunity for ongoing education in terms of annual conference, annual meeting, and that should be supported officially by the government, by the ministry, so that people have a chance to discuss. Now, mental health need is fluid. It's not stable. Not like, you have chest pain, I give you this medication, or you have infection, I give you antibiotic for 2 weeks and that will be okay. This is not. This is a chronic disease. We need to have a chronic disease management. And then we have to prepare that there would be flare-up, would be fluctuation of symptoms, depend on psychosocial stressor, what is exactly this. That don't expect that we cure people. We should expect that we walk along the line and hold people's hand, and so that we go along the pathway, and hopefully the recovery would come at a certain stage, but recovery doesn't mean symptom-free. I talk about that all the time in PTSD principle, that we can work with our clients to forgive, but almost impossible to forget. So I think that every mental health professional should keep that in mind. However, the cannot forget doesn't mean that it's not healed. It healed differently, but the scar is there.
That's great, Dr. Ganesan. Thank you for that. I think the idea of having a more holistic approach to mental health, having different specialities, also having trauma-informed consent training is definitely a key. It's involving everybody in the patient's experience, and also understanding that it's a journey. It's not it's not something that ends after one treatment. It's a journey, and everybody's journey is different. So on behalf of NYRC, we really want to thank you for speaking with us today on Truth and Reconciliation Day, and for sharing your insights and your wisdom from a cross-cultural psychiatric perspective. Do you have any final words for us, or otherwise we'll...
Well, we started late, but I hope that we are going on the pathway, and that in the pathway, there's a lot of other smaller way, and we should keep an eye open. And there's no wrong way, as long as we are supportive and focused on recovery.
Fantastic. Thank you so much, Dr. Ganesan.